Hi, this is Superintendent Jesse Washington, and you're watching Orangeburg Educational Network.
Yeah, hi, Harvey. We're here at the High School for Health Professionals, and we're here on a day of activities when they have invited physicians, 9 physicians or 9 medical practitioners, both nurses and doctors, here to the school as an inspiring group of people to talk with the young people who are students here at the High School for Health Professionals. I've got the principal, I've got Ms. Lodho, 2 of the organizers, one of our physicians who's here from Kmart, is that right? Correct. Kmart Physicians, and of course Mr. Patrick Nowak, of course, he is from Teach for America, and he's also a teacher here, one of the better teachers that we do have. I mean, we got a bunch of good teachers. I better be quiet if I get myself in trouble, right? Anyway, let's hear from all of you. If you will tell us about today's activities and today's event and what your role is.
Oh, wow. I tell you what, today has been tremendous. It's been a day of exposure, and thankfully to Ms. Lodholt and to Mr. Nowak for planning such a day with our seniors, sponsored by the senior class, to give exposure to all of our kids with for the Health Symposium. And we're just glad to have and honored to have those individuals who have realized their dream in the healthcare profession, such as Dr. Richardson, who's a pharmacist at Kmart. And they're able to ask questions, as well as the presenters are able to be transparent to tell about their journey to getting there.
In coordination with Ms. Lodholt and myself, we were able to bring in a bunch of speakers. Ms. Lodholt brought in 9 community speakers, and the senior class coordinated the event. So as the senior class advisor, I've been helping them to coordinate it, make sure that all the logistics have been done, and that the students had the exposure that they needed to get there.
Dr. Richardson, tell us about how you're inspiring these young people. Tell us about your involvement here, if you will.
Well, when I was reached out to by Ms. Lodholt about the symposium, I was extremely excited to get the opportunity to provide them with information on a field of healthcare such as pharmacy. I know that a lot of people don't have the opportunity to know what my career involves, and the other members of the panel got a chance to be very transparent about the education that's involved in getting into the field and what it takes to stay, the role that we have in our communities. And quite frankly, I was honored to be here to have a chance to talk back to the youth about what all is entailed in this career field and answer their questions that they have about it.
All right, now here we're going to come over to the big organizer, the big cheese of this whole thing. Ms. Lodholt, you're going to tell us about your role and how much you put into this. We know how important it is to you if you tell us.
Well, I've always wanted to bring actual health professionals to the school so that students could actually see what was necessary in order to become a health professional. I wanted them to know what was required of them academically, what was required of them when it comes to the training and the commitment necessary in order to achieve their goals. So we are very fortunate to be able to have at least 9 professionals here. And the ironic thing was, when I called them and contacted them, they were thanking me for having them. So we're very pleased about that. We'd like our children to start a mentorship program with them. We'll do it virtually because all schedules are busy. And they have had a chance today to be inspired, to be motivated, and to receive some great advice when it comes to the plan of study, and just try to make up their mind about what they really want to do and make a decision about whether the health field is the field for them.
I was inspired today talking to Miss Ashley because she wanted to go into the medical field to go behind her father and mother, but when her first year of college, she decided that it wasn't for her because science is hard. I don't like science. So she made me think about a different career and going to a different field.
All right, tell us about how you were inspired by the day. Which one of these people that spoke to you was so inspiring?
Miss Richardson, because she actually worked with some of the things that I want to go into. I want to be a pediatric oncologist nurse, and so she told me about some of the things that she does, that she did with oncology and everything like that.
I work at Palmetto Health Richland Heart Hospital, and I believe that the children are...
You work with Dr. Phillips?
Yes. Okay. I believe it's important to encourage the children because they need guidance and they need direction, and I'm more than willing to come help them in any way that I can. I have 2 of my own, and I think this was a good opportunity for them to get to experience and see what we do.
And Dr. Maisie?
Yes.
Okay. Right. See, I know both those doctors up there. I wish I didn't, but I happen to know. Well, no, actually, I'm glad I do know them. Now, tell us, you're from the Department of Mental Health?
I actually am from the Dorn Medical Health Center.
Right here in Orangeburg.
Right here in Orangeburg. I work at the Orangeburg Satellite Center office. I'm a mental health treatment coordinator. Been doing mental health for 26 years, and I think it's wonderful to have persons come back and tell about how they were successful once they're leaving high school. I didn't have the opportunity to have.
I am a speech language pathologist, and my role is in the medical field. A lot of times we hear speech therapists are in the schools, and so I work with a rehab team, and so people with strokes, traumatic brain injuries, cognitive impairments, swallowing impairments, I see those people and we try to rehabilitate.
Senior citizen facilities, or are you
right.
in school?
I'm in the senior citizens, but not all of my patients are senior citizens. My youngest patient, I was telling the students, was 17, or maybe a 36 or 21. So sometimes I see patients that are not necessarily geriatric, but brain injury. I get a lot of kids. Motorcycle accidents, car accidents, even some drug abuse of younger people that I see who've had strokes and just trauma to the brain that's impairing their speech and their swallowing. So I get to see a lot of that stuff.
I'm a biomedical engineer, and I worked for a couple of biomedical orthopedic companies. One being Medtronic, which I assisted cardiologists and electrophysiologists in implanting cardiac devices for heart disease patients. I now currently work for Stryker Orthopedics, in which we repair sports-related injuries in the shoulder, hip, and knee.
Have any famous people that you've worked with in recent times?
I would say one of the physicians that I work with is a team physician for the Chicago Bulls. So using my company's technology, we repaired Derrick Rose's ACL, so Jabari Parker's. So I think it's amazing to be exposed to injuries and assets in the medical field in that way.